Great, thank you very much. Let's just perhaps work down the table and with really just highlighting what you think are important issues that the students should know about and what you feel is the most crucial issue in stem cells today. I'm sure you've all thought about it already and you have something very planned, but let's start right here.
I'm just getting used to the mic. So my perspective in terms of the validity.
Well, what do you think? Let me ask you this. So what do you think are the most pressing issues, both in the translation of stem cells right now, but also from the ethics side? So we have like the hope side, what we want to have happen with stem cells, and what you view as some of the biggest ethical challenges from your perspective, which I think is both a unique perspective because you come at it both from the patient perspective, but also from the scientist perspective.
Well, I think, I mean, as far as I'm aware of where this field is right now, I think from the patient perspective and scientist sort of mixed perspective, I mean, I really think it's important for patients to understand what kind of treatments are developing and what it means for them, because a lot of patients living with diabetes are looking for a cure, and as soon as they hear something will give them what they're looking for, they're often ready to jump onto that. So I mean, I think regulation, in a sense, not even necessarily regulation explicitly, but developing anything that is developed, any sort of breakthrough or therapy that comes from stem cell research, I guess just needs to be communicated very clearly, because I think that's the major issue for people living with type 1 or type 2 diabetes. If there's like a solution or something that seems that it's a solution but has not been tested properly and has serious risks, patients need to be aware of that. So the science needs to be, I mean, very clear, but obviously communicated properly. I think that's the biggest thing, the lack of communication that feeds into the fear that people living with type 1 and type 2 diabetes have. And if there's something that seems to be a solution but can actually lead to more problems than fix the ones they're looking to solve, many people can get into very bad situations. I mean, so the communication, I think, from the science.
So do you see in the patient community that you've had access to a lack of understanding of where the science is? Do you think that there is this belief that perhaps is closer to the clinic than it really is?
Yes, actually, but I mean, that's obviously a small sample size. There was a paper published, I believe in October, where they were able to generate from, I believe it was pluripotent stem cells, beta cell-like cells, so glucose sensing cells, so basically they actually respond to glucose. And many people, once they see this, so the idea is then I can't remember what the timeline was, but that these could be used for patients, and that this, by the end of 2015 or 2016, these would be available. I mean, so one thing there is people, as soon as they see something like this published that they don't completely understand, they get very excited. And so from this data, like, people have been working on creating beta cells from pluripotent stem cells for a while, and this is sort of a breakthrough in that they're glucose sensing, and there's potential to use it in patients. Patients immediately think in the next 3 to 6 months, this will be available, it will be a cure, and then if someone else who isn't necessarily using the science or for whatever reason comes up with something that isn't completely sound, patients are ready to jump on board. So that process begins even before, and this is what I've heard from people with type 1 diabetes, especially, like, as soon as they see this paper published, they're waiting for
they want access
thing.
for it.
Yeah. So if someone else comes up with it, even though it may not be sound, they are likely to listen to whatever this person is
Interesting.
saying.
So let's just go down the line, because I think this is a really important point. Do you guys also get that sense that some in the public think that they don't either understand the basic nature of some research, or they think it's closer than the clinic than it really is? Does anyone want to comment on that? Because I think that's really at the heart of some of this.
I'll comment. As a scientist, you always want to talk about positive data and positive things, but you have to keep in mind, and as my grad students will understand, 9 out of 10 things fail. So you have a great idea, you think this is fantastic, but it's really, there's probably a 10-year timeline from the time you have a good idea to the time you can even consider clinical trials. And there's about a 95% failure rate. So by the time you do hear about some great discovery that's published, even in a high impact journal, the timeline is really long, and people, we're excited about it in the lab, but we understand it's 10 years before, there's a 5% chance it'll make it to the patient, especially with stem cells. But the public doesn't understand that, and it's not real. That message isn't
So
translated.
it's a 10 years to the 5-year possibility.
The
That's-
5%
But
possibility.
the important point, and let's be glass half full team here.
Yeah.
A failure from a scientific perspective isn't always bad news, right? Because we learn from everything,
Yeah.
right?
Yeah.
And so
You
that's
just go off
still
on-
science.
Yeah, but you just go off on tangents.
Yeah.
So there's no direct route. I'm going to, cure diabetes. Set out to do that. The path isn't linear. It goes off on tangents, and that's why it takes a long time.
Yeah. Comments, you guys?
Yeah, so I see it from two perspectives. I'm a clinician scientist, which means that I do clinical trials of new therapies, attempting to improve the treatment of generally type 2 diabetes, sometimes type 1 diabetes. And as well, I'm a clinician, which means I see patients and are directing their clinical care for diabetes. And I think there were so many important points that came out in Dr. Caulfield's talk before this. I really like that term science exploitation. Was that it?
Science exploitation.
Science
Yeah.
exploitation. Haven't heard it before, but totally understood the concept because we're bombarded by this. We're seeing this constantly. I think it's very true what Dr. Rogers just said about people don't recognize the timeline. And the timeline gets further distorted because of the way that the press wants to portray things. So even legitimate scientific discoveries, very good science in top-notch journals, when the message is going out through the media, it's getting distorted. And it makes it very hard for the public. And I think it was great. There were some questions for Dr. Caulfield about where can you look for legitimate sources of information around these issues. At the end of the day, I think the most important issue is for anything like this, we need a robust body of evidence on the back of rigorous clinical trials. And that's how it is for all of our other therapies, and it will be the same for this. And this is part of why the timeline is so long. Unfortunately, as patients, it's difficult to accept because you're looking for something right now, and unfortunately, conventional medicine isn't going to be able to provide that answer immediately with that body of evidence, because it's going to take, I would argue, longer than 10 years before you have that body of evidence. Something that people often don't recognize is that, you all recognize, of course, that bodies like the FDA and Health Canada put lots of requirements for data of efficacy and safety before approving a new drug or a new device or therapy. But keep in mind that as rigorous as those requirements are, they're dwarfed by the amount of experience we get in the first few years when a drug comes to market. And so that just tells you how much data is needed before we can truly be confident about the safety and efficacy of things. And so you can imagine how, given this kind of timelines and the kinds of the volume of data that's needed, how individual trials of or a study in just Rafael Nadal or Gordie Howe is by definition insufficient. It speaks very nicely to what you were saying about how testimonials can be taken as a bad sign, because that means the absence of the kind of data that not only the absence of the kind of data that we need, but the marked absence that you are light years away from the data that you need to really be confident about therapies.